Hello, my name is Gabriela Luzuriaga Maldonado, and now I'm going to talk about Ribavirin for chronic hepatitis E virus infection in transplant recipients. For definition, hepatitis E is a liver disease due to infection with the hepatitis E virus. The virus is excreted in the feces of infected people and enters the human body through the intestine. Continue with the pros. In areas with better water supply and sanitation, hepatitis E is rare and only sporadic. And about cons, the disease is prevalent in low and middle income countries with limited access to essential water, sanitation, hygiene, and health services, such as war zones and camps for refugees or internally displaced persons.
Hey, thank you for watching Medical Perfectionalis. Hepatitis E pneumonic. The E pneumonic, also known as the EU pneumonic, coming up. Hepatitis E, remember EU. It causes jaundice in the far east, Egypt, and by Egypt I mean Africa. By the way, Egypt is my home country. India, Central America, contaminated water, contaminated is undercooked seafood. Sometimes some genotypes of Hep E are endemic in the swine. So undercooked pork can cause Hep E, hepatitis. So swine, pigs eat everything, including garbage and worms. So that's ew. No offense to pigs. Fecal-oral route of transmission. Sometimes it's common in pregnancy. And when it comes to pregnant women, it's fulminant. Fulminant means massive necrosis, which can lead to failure. Ew. And there is marked cholestasis in hepatitis E. Mostly it's acute. In these countries, sometimes it's the most common cause of acute viral hepatitis. Wow. But, however, it also can be chronic, such as patient with HIV or patient with immunosuppression. Some textbooks, including Harrison's, which is my favorite book, I will link it in the description, it regards Hep E as an opportunistic infection for people with HIV. So, acute will have IgM antibodies in the blood, and chronic will have anti-HEV IgG. It's very similar to Hep A on electron microscopy. To remember that A and E are both vowels. Okay. Remember Hep D was dependent on whom? On Hep B. So you can draw D like this, and you have B, and A are vowels, so they go together, and these go together. Anyways, so that's it. Now you know everything you need to know about hepatitis E.
Continue with the applications in medicine. It is transmitted mainly by the fecal-oral route when consuming drinking water contaminated with feces. The incubation period after exposure to hepatitis E virus range from 2 to 10 weeks, with an average of 5 to 6 weeks. The characteristic signs and symptoms of hepatitis are an initial phase with mild fever, decreased appetite, nausea and vomiting, pruritus, jaundice, and hepatomegaly.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete's case, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
Continue with the usual apply in Ecuador. Ecuador is not an endemic country for hepatitis, as in the case with Peru and Brazil. However, despite the fact that the national rate is less than 8%, it is believed that there could be people who suffer from hepatitis, but they have never been diagnosed due to not having sought timely medical attention.
There are various causes of hepatitis, but today we are looking at an infectious one called hepatitis E and how it can affect you. Did you know that your liver is the heaviest organ in your body? It does several important jobs, including cleaning your blood and producing a liquid called bile, which helps digest your food. It's important to keep your liver healthy, which is why you want to avoid hepatitis, a term that is used to describe inflammation of the liver. The hepatitis E virus, known as HEV for short, can cause infection through several routes. One of these is by eating undercooked pork, wild boar meat, or pork products. Although HEV can be present in animals such as pigs, it does not normally make them ill. When it infects humans, the symptoms of HEV infection are usually mild and clear up in a few weeks. However, the disease can, in rare cases, cause serious health problems and even death. The good news is that you can reduce the risk from HEV by following a few simple steps. In cooking whole cuts of pork, wild boar meat, pork products, and offal such as kidneys, make sure that the meat is thoroughly cooked and not pink when you cut into the thickest part, that it is steaming hot all the way through and any juices run clear. Practicing good hygiene is also important. Wash your hands thoroughly before preparing or eating food and after using the toilet. Always remember to clean surfaces properly and chill food at the correct temperature. Handle it carefully so it doesn't cross-contaminate other foods or surfaces. So there you have it. FSA explains hepatitis E. To find out more, visit food.gov.uk.
And finally, the conclusion, the antiviral ribavirin may be useful in treating immunosuppressed patients with chronic hepatitis E. In certain situations, interferon has also been used with satisfactory results.
Our lab studies hepatitis B and E viruses, which cause about 300 million infections worldwide and kill almost 1 million people annually. Neither one has a cure. We have developed new screening systems to identify new drugs to cure these viruses. Both hepatitis B and E viruses affect the liver, but they are very different viruses. Hepatitis B virus is transmitted through the blood and other bodily fluids. It enters liver cells where it hides in the nucleus. We try to find drugs that can kill this virus without causing harm to the patient. Hepatitis E virus infects people through contaminated pork meat and water and stays within the cell body. We try to find molecules that can stop the virus from making copies of its genome. Our screening systems are faster and safer than existing platforms. Our systems are high throughput, meaning that we can screen millions of compounds within a short period of time. We modified both viruses so they are safe and robust for screening. The screening system closely mimics the situation in patients with chronic hepatitis infections. With these screens, we hope to provide cures for viruses that cause serious global health threats.
Thank you for your attention.